Our founders had it right when they thought that what we would do is to create states, and the states would have most of the power. The federal government wouldn't have a whole lot. And to make sure that we understood that, after this incredible debate between Alexander Hamilton and Thomas Jefferson, in which Hamilton really wanted a centralized federal government, and Jefferson said, no, that's too dangerous, we need to diverse this power. Well, Jefferson won. The 10th Amendment was added to the Bill of Rights so that we would forever enshrine the idea that if it's not specifically written in the Constitution, the federal government's to keep their hands off of it and let the states do it. And what's unconstitutional about the proposal of health care is that there's not one thing in the Constitution that says the government ought to decide who goes to the doctor, which doctor you go to, how much the doctor's going to be paid, and which procedure you get. Folks, somebody needs to take the tongue depressor and put it on Nancy Pelosi and Harry Reid and say ah and ah nah, because we ain't having that. Folks, it is a ridiculous, unconstitutional assault on our basic freedoms to think that the federal government is going to do it. There was a time when we would have had experiments at the state level to see if they worked before other states tried it. Now we want to try a federal program and mandate it upon the states to force them to do something that has already been proven to be a failure. You know, if we were going to do a federal health care program, what we ought to do is to find out, have any states done something similar? Actually, two have. Tennessee and Massachusetts. And Oregon. I'm more familiar with Tennessee and Massachusetts. I'll grant you that Oregon has done it. I don't know. I'm sure they have. They've done some other weird things in Oregon, too. You're from Oregon. I do know that in the case of both Tennessee and Massachusetts, it's resulted in the virtual bankruptcy of the states. It has caused people to wait for great lengths of time to see a doctor. It has been, by anybody's estimation, objectively, an absolute miserable failure. And the only bargain that has happened in Massachusetts is the accessibility of a $50 abortion, which is guaranteed under the Massachusetts plan. $50, and you can take the life of an unborn child. So since it hasn't worked, what's the federal response? Let's give it to the other 48 states. What a great idea. And that's why I say it's time for us to do what this conference is all about. Take back America, not with violence or anger, but with the same kind of skillful, thoughtful, and absolute diligence in which we have seen Phyllis Schlafly give herself and her life to making sure that America did not make a mistake and go the way of the extreme left feminist who would not have elevated women in this country, but would have devalued them.